Well, essentially an implant is an artificial replacement tooth, right? It can look and feel and function just like your healthy regular tooth, and or sometimes, even better. So people who need implants, as long as you're healthy, we do implants in people from 20 years old to 93 years old. It's the oldest person I've done an implant on, several of them. People might be a candidate for dental implants if they're missing a single tooth, if they're missing several teeth, or even if they're missing a whole set of teeth. You might also be a candidate for dental implants if you have a denture that's loose and needs stabilized, or if you have some broken down teeth that you need to have removed and you want to replace them. Dentures without implants have a lot of limited functionality and support. You're pretty much relying on just your ability to keep them down with your tongue or your lips or whatever. That's not very good for a lot of people, and a lot of people struggle with them. So with implants, we're able to put in as like an anchor pretty much for the denture, so they can snap it into the implants. It doesn't move, it doesn't flop out when they're talking, and they're able to, for most people, they're able to eat pretty much anything they want again, which is pretty amazing. And then they can take it out and clean it, so it's very accessible for cleaning and hygiene. Every patient who comes into our office, we use 3D imaging technology. So first step we'll do is when you come in for a consultation is you get that 3D x-ray. And from that x-ray, I'm actually able to evaluate the bone quality, where we want to put the implant, and also avoid, if there's any anatomy that we're trying to avoid. From that image, I can actually go in and digitally plan the implant to know down to the millimeter exactly where it needs to go. So for our patients, before they even sit in the chair, I already know where this implant is going to go. It makes the surgeries very quick. There's no surprises, and we just get a very predictable outcome. The 3D imaging technology has come such a long way from where it first started, 10, 20 years ago. We're actually able to evaluate a site, and we can actually look at what quality of bone is going to be around the future implant. And so I can actually look down from the very tip of the implant all the way to the top, what kind of quality of the bone is there. So it's super helpful, and we just have so much more knowledge now about how we can place these the best possible way so that we get the best possible outcomes for our patients. One of the things we really offer patients is the convenience of doing everything under one roof. Oftentimes people have to go to multiple different offices and specialists and meet new doctors to have their implants done. But with my training and my team's experience, we do everything under one roof. Very start from removing the tooth and bone grafting, all the way to putting the crown on top of the implant. So it makes it very convenient for people. I have control over all the factors and the equation now, instead of relying on other multiple people. Another thing that we do is we do a lot of what's called immediate implants, meaning we take the tooth out and put the implant in all at the same time. And what this does is it allows us to save about 3 to 4 months of healing. It also provides a more natural looking aesthetic result. So you get a better result in half the time. For implants, what more could you ask for with that kind of outcome? And so we're able to do that kind of immediate. About half the implants we do immediately. Implants have changed, and they're continuing to change so much because we just know so much more now than we used to. Implants were relatively new, 10, 20 years ago, but we just have all the data now to be able to really analyze and say what's the absolutely best way to do this and the most effective and efficient way to do it. I spoke about immediate implants. We didn't do that 20 years ago. But with how implants have changed now, we're able to know exactly what to do to get the best possible outcome in almost every single scenario. We can do things now, teeth in a day, replacing whole sets of teeth that were a dream 20 years ago. If you're nervous about the implant process, I would just say come in and meet myself, meet my team, and we'll walk you through the entire process. And I think you'll really see that it doesn't have to be such a scary procedure. I think a lot of people make it up in their mind that it's a lot more invasive than it really is. Oftentimes these surgeries are very quick. They have very, very little post-operative pain or discomfort. And I tell a lot of people, getting the tooth removed is a lot harder and a lot more uncomfortable than getting the implant done. The implant's the easy part.